So you want to leave some telltale sign that there is something sharp so you don't get the next person stuck. Yeah, this gauze actually is kind of hard to use the second time around. This is where it's good to be first in line, I guess. Perfect. So as long as his fingers don't turn blue. And see, this is where also that you could use that sling. He's broken his arm, a piece of it's sticking out, you bandage it up. Now put him in that sling so his arm's rested. Keeps it up and against the chest. You would use the same technique, you would perform it the same way. If this is a burn, you would just make that burn, or the dressing, a lot looser. Just kind of pluck it out. Like,
Sling blade.
that's actually really good. There we go. A little bit more like that. That's going to allow everything to swell.
That's good.
Because what's going to happen is their hand's not going to be blue. It's not going to be numb at first, but as that burn swells, an hour later, their fingers may turn blue. And you may have forgotten about it by then.
Thank you.
Yeah, if you're just using the gauze, you should be okay. But if you put like anything sticky over it, it's going to be a pretty big issue. Yeah, I wouldn't use a towel. Yeah. See, the problem with the third degree is you've gone through all of your tissue, and so it's wide open there, and any germs or anything is going to get in there. So you want to cover that up. Yeah. Yeah, the third degree burn, you may not even feel pain at that burn area. It burns through the top layer, the second layer, and then sometimes through the muscle. It gets all the nerves, kills the nerves.
You would still rinse it with water.
Yeah. Yeah. It's going to be a couple weeks later in the burn unit that they start feeling a lot of pain as those nerve endings grow back. But yeah, it's going to be black, it's going to be charred, bubbling. It's going to be real nasty.
I didn't think nerves grew back. I thought once you destroyed it.
They will, they'll grow back a little bit. They're going to have to put grafts on it if it is a deep enough burn. They'll take skin from a cadaver or skin from another spot on you.
Skin nerves.
Oh, the nerves should grow back.
Sometimes it's very slow.
Yeah. Yep.
When you mentioned impaled objects, we wrap around the object, not over it.
Correct. Wrap around it, leave a little bit of it sticking out.
Okay.
So like if you've got this pin sticking out of your hand here, you're just going to wrap and then come over here and then wrap here. You're just wanting to keep it as secure as you can.
All right.
Because as it's wiggling around, does this hurt? Does this hurt? It's going to be causing more damage. So the more secure it is, the better off they're going to be. If you have an eye wound, you want to cover both eyes. Because if you're looking with this eye, but you got a pencil in this eye, both eyes move. So you cover them both so they're not looking around, so they don't have that issue of hurting themselves by trying to look at something. You could put a cup over an eye and have that pencil out of it. So yeah, that way it's holding it secure. Hopefully that doesn't happen. You guys are working with nail guns and things like that, so you never know. But do you carry first aid kits with you?
Yes.
Okay. Are they pretty well stocked?
Yep.
Good.
If you have something in your chest, though, you take it out.
Yeah, if you have something in the chest that's impeding breathing, you have to take that out. Because we're always talking airway, breathing, circulation. So if you're not breathing, circulation is below breathing. So you got to get that object out so you breathe, then you worry about circulation. Even if you pull it out and it's causing more bleeding, you can put pressure on that, but at least now maybe the lung will fill up. So yeah, otherwise keep it in there. If it went through the cheek and it's just in the mouth, that's one that you can pull out. But 9 times out of 10, just keep it in there. And again, if you see bones sticking out, don't push them in and don't pull on the objects. Other than that, that should be about all you're going to need to know for that. I want to go over the first aid test just to make sure we didn't miss anything. The CPR, I'm not going to go over that, or the AED, because we seem to have covered everything. You seem to get that pretty well. I just want to make sure I didn't miss something on the first aid exam.
Maybe something about heat stroke and heat exhaustion.
Used to be. They don't really cover that this time around. It's an optional piece, but they don't cover it too much. Either the cold-related emergencies or the heat stroke. They just kind of, I don't know why they don't do that anymore. But yeah, that's just going to be the one where you can dump water on their head, give them something to drink if possible. If you're getting to a point where they're so hot that they're not sweating anymore, that's going to be an emergency. You need the EMS to come. Otherwise, typically you can get water into them or some sort of fluid and they're going to be okay. Just don't take them back out into the heat. It takes a while to get to the heat stroke spot. But there was a kid at Purdue last semester, went down to South America, and he wound up dying from heat stroke. So it does happen. I'm not sure what was going on with that, but you don't drink enough water and you're in the heat long enough, it can catch up with you. What was FAST? Do you remember FAST?
Face, arm, and
Speech. Time. Yep.
What was the S?
Speech. So you got face, arm, speech, and time. So you're telling them to smile. And part of it's drooping down. Hold out your arms, one of them will drip. Or you could do a grips. Hold two fingers like this and have them squeeze. One side is going to be a nice hard squeeze, the other one you're not going to be able to feel it. So you could do a grips instead of the drift. But that would be your arms. Speech, ask them to say something. See if it slurs, see if they're not saying things correctly. And then time, you want to note exactly when it happens so you can get medication to them. What are we doing for burns? What's the first thing you want to do with that? Water. Cool it down. What sudden illness usually caused by a blockage of blood flow to the brain? Stroke. What do we need to do for somebody having a seizure?
get any objects out of the way.
Mm-hmm. Objects out of the way. Don't hold them down. No peanut butter. Yeah. You're protecting their head. If they hurt, their arms or their legs, that's going to be okay. You just don't want them to get a brain injury while they're flopping. Main thing for you guys, just drink lots of water. If you're going to be out building houses and stuff, keep yourself drink as much as you can. Even if it's a cold day, you still want to keep fluids in you. If you have an open wound, it continues to bleed, what are you going to do?
Put pressure, roll it up.
Mm-hmm. Put pressure, hold it up, maybe get a pressure point, get underneath the arm, get an artery. And then we talked about frostbite on the fingers. How are we caring for that? What's that? Yep, armpits, skin-on-skin contact. You could even use lukewarm water if you wanted to do that. It's just like room temperature, just a touch above. And you can put their hands into that as well. Just as long as you're not rubbing them together, because that's going to cause a lot of skin breakdown and tissue injuries. But other than that, are there any questions? Any at all? You guys are done. I've got the certifications back there. I need to sign them off. I'll pass them out to you. But other than that, you're free to go. Or do whatever you need.